So I'm Mark Parascandola, Chief of the Research and Training Branch at the Center for Global Health at the U.S. National Cancer Institute. So tobacco use is, of course, one of the leading preventable causes of cancer worldwide and warrants the focused attention of the global cancer control community. And while tobacco use is declining in many parts of the world, including among many high-income countries, this is not necessarily the case on the African continent. Historically, tobacco use prevalence has been lower in Africa compared with other world regions, but in recent years, we've seen tobacco consumption and prevalence have been steadily rising. And in fact, Africa is one of only 2 WHO world regions where tobacco use is projected to increase in the coming decade, from around 57 million estimated smokers in 2015 to 67 million projected smokers in 2025. Additionally, 4 of only 5 countries on the globe with increasing current tobacco use prevalence estimates are on the African continent. And finally, the WHO estimates that the number of tobacco attributable deaths on the continent will double by 2030. So most African countries have already ratified the WHO Framework Convention on Tobacco Control and have adopted national tobacco control legislation. However, implementation of these FCTC tobacco control measures remains incomplete, and African countries face substantial challenges to their progress in tobacco control. Several factors, including economic growth, a young and growing population, rapid urbanization, and cheap, affordable cigarettes, contribute to rising tobacco use. Additionally, the multinational tobacco industry is targeting Africa as a growth market. Tobacco industry marketing strategies are increasingly being used to recruit women and youth to begin smoking, such as through using celebrity influencers and sponsoring concerts and other events. And multinational tobacco companies have sought to influence African governments to counter tobacco control measures. Finally, this situation is complicated by the fact that tobacco farming and production have a significant role in some national economies in Africa. Notably, Zimbabwe and Malawi have figured among the top tobacco leaf growing countries in the world by tons produced. So scientific research has been instrumental in the development of evidence-based tobacco control measures, including measures in the Framework Convention, and research continues to play a critical role in supporting global tobacco control. And because of the diversity in tobacco use behavior, socioeconomic and cultural factors, and health regulatory systems across countries, implementation of tobacco control measures needs to be informed by locally relevant data. And additionally, interventions tested and developed in high-income countries may need to be adapted for other settings with the engagement of local researchers. So it's important to understand the existing landscape of tobacco control in Africa and to work to build local research capacity. So given the central role of tobacco control for global cancer control, it is also critical to strengthen collaboration between the cancer and tobacco control research communities. So researchers, clinicians, community leaders, and advocates for health should all be involved in tobacco control as a key strategy for reducing the cancer burden in Africa.